Today we're going to talk about the special education assessment process and the determination of services and placement. When a child is assessed for special education services, there may be 4 domain areas that the public school or county education office wants to pursue based upon the concerns of the child. Those are academic, neurological, psychological, and social-emotional. The assessment tools will vary. Some will be normed and some won't. Parent input into the assessment process is crucial. The parent can provide insight on the child's developmental growth, what is occurring at home, and how the child interacts throughout the day. Classroom-based assessments from the general education teacher or other teachers is also very important to give a glimpse into the child's educational day. Functional and developmental information. Has the child met their typical milestones? Walking, talking, interacting with peers. Has the information concerning access or progress in the general education curriculum been properly reviewed? We need to use technically sound and well-normed assessment tools, and this includes that our assessment tools are culturally normed and language-based. And then, of course, we need to look at the cognitive, behavioral, physical, and developmental factors of the child during their growth throughout their time since birth. There are 4 different kinds of educational plans that a child can be placed on if they qualify for special education services. The most common one is the Individualized Education Plan, which is for children ages 3 through 21. The Individualized Family Service Plan focuses on ages 0 to 3 and sometimes is used for children up through the age of 5 or kindergarten, whichever comes first. The Individualized Transition Plan under federal law has to be implemented by the age of 16. However, some states implement the plan at the age of 14, which is completely appropriate. And there's the Individualized Service Plan. The service plan is used for children placed in private schools by their parents. However, the district wants to provide special education services for the child, and an individualized service plan is developed in collaboration with the private school. Members of the assessment team, of course, include parents, the student when appropriate, especially as the student gets older, regular education teachers, special education teachers, district representatives when a child from a private school is assessed, others with knowledge or expertise regarding the child, someone who can interpret the evaluation report, whether that's due to a language barrier or if a parent has a friend who has experience in special education and would like them to attend. Representatives from a private school when a child from a private school is assessed, or any other agency or advocate. If the student qualifies for services, then what services does the student qualify for? Services are not done in a place. Special education is a service, not necessarily a placement. And we often talk about special education as being a place. However, today, with our inclusive environment, oftentimes these services are now provided within the regular education classroom. How often will the student be provided with these services, and for how long? During the day, 30 minutes, 45 minutes a day, 3 days a week, 5 days a week. And what are the goals and objectives of the services, and how will they be evaluated? Children who qualify for services do so by meeting 1 or more of the 13 categories of disability. Their disability adversely affects their ability to perform at their ability level, and a need for special education services as specifically designed instruction. So as I mentioned, special education, is it a place or is it a service? Yes, it can be both. However, as we continue to move into environments that are inclusive, usually those services are done in the general education classroom, but not always. A place could be a general education classroom, a special day classroom, a resource room, a home hospital program, juvenile hall. Services are provided in a variety of placements. And we have to keep in mind, though, that special education isn't a place, it's a service.